Hi, this is Bharat Pathy. Along with Joel Prevalent, this is part two of the rise and fail of modern medicine, especially with attention to US, presented at the OSHER USF on Zoom in February of 2023. In part one that I had uploaded, we stopped somewhere at 1940s after the discovery of penicillin. Before that, we had talked about in general what is sickness, health, definition, and some of the problems that we have encountered with increasing aging population. And we talked about the big discoveries that have made impact. The first one was we discussed was insulin. And we stopped at this level with the discovery of penicillin, which revolutionized the treatment of infectious disease as we have come to know it. And so that was a fascinating story that we went to. But I think at that point, my slides had frozen or something, and I could not advance it any further. So that was the problem that we encountered. Okay, let's see if I can advance this time. Apparently not. Okay, I'll see what I can do type thing. So, okay, yeah, this is the better slide type of thing. So I'm in business type thing. And I think you should still be able to see my slide, which should be, this is the one that should show actually. I think we have a problem that my slides are not advancing like they should. Okay, I will stop the present share and I will start all over again with, because you should be able to see the slide which shows okay, I think I have a glitch somewhere along the line, the slides are not advancing. So okay, yeah, I think we're in business now. You should be able to see the slides now. And I should have the Zoom view. Okay, I think you can see the picture of the great Helen Taussig, who was the professor of pediatric cardiology at Johns Hopkins, and she was one of the pioneers in the field of heart surgery. She had genuinely paradigm shift with the illness called the blue babies, and came up with the idea of creating an artificial shunt from the blue side to the red channel. I'm sorry, the other way around, from the red channel to the blue channel to mixed blood and helping blue babies survive. Initially, perhaps because she was a woman or it was such a radical concept, her idea was poo-pooed by the Boston Brahmin surgeons, but was taken up by Dr. Blaylock, and along with his able assistant, Vivian Thomas, they revolutionized modern surgery as we know it, type of thing. Okay, and let's see, I think okay, so and that was the start of pediatric surgery, and Vivian Thomas faced racial discrimination, was not allowed to enter from the front side of Hopkins. He was better than a surgical resident and was an able assistant to Dr. Blaylock. And next, another woman who changed the practice of newborn babies was a woman named Dr. Virginia Epgar, who again was in the early 40s and devised a very simple observation-related method to assess babies, at the time of birth and diagnose prematurity based on criteria. So that score is still very widely used. She was a professor of anesthesia, and the score it really changed the effect of maternal anesthetic, baby Epgar score. So actually, looking after two lives, which can be a challenge type of thing. And then again, and so that revolutionized subsequently with the invention of newborn intensive care unit with incubation and the whole development of new mid specialty. But as it happens in medicine, we take 2 steps forward and 1 step backward. And while granted, newborn intensive care has taken tremendous advances in saving 30 weeks old and pushing the envelope further and further down to 25 weeks, which babies are really very tiny, weighing less than 500 grams, and even up to 330 grams. But again, we have to come to the question that some of these babies they can develop oxygen toxicities, they have severe birth abnormalities, their lungs are weak, they're susceptible to infection, and they're subjected to a lot of pain. Just because they cannot complain of pain does not mean they don't feel it, obviously. And granted, it is for a better purpose for saving their lives, but still, sometimes the pendulum is pushed way too far. And as recently as just a few days ago, there was a article written by a caring mother as to how her baby had genetic defects and had required multiple surgeries, and already was, again, for a simple cleft palate repair, the surgery went complicated and required intubation, tracheostomy. But the mother writes at no point anybody brought up the idea that enough is enough, that the word hospice for newborn baby was never entered, it was never taken into discussion. At the same time, there are parents who are willing to go through this anguish and are able to participate in the care. I placed a link from a Canadian couple who had twin babies, which were 300 pounds, 300 grams type of thing. And they were able to go through a lot of supportive care. And it's a different system. So it's a very ethical and moral dilemma type of thing. And then we talked a little bit about the golden age of medicine, and medicine really truly became science, perhaps after the discovery of these 2 major drugs, i.e. insulin and penicillin, where we conquered the so-called low-hanging fruit of infectious diseases. It was become relatively easy to treat pneumonia and varieties of infections. And again, at the same time, all these other disciplines were coming into their own, so to speak. The chemotherapy we'll talk about in general, and cardiology was progressing further with treatment of blood pressure, and the early days of diagnosing myocardial infarction in more accurately, and the varieties of new technologies such as cardiac ultrasounds were coming in. The ideas were borrowed from sonar, and then later on in the 50s, CAT scanning became available, and we talked about the hormones that were discovered back in the 30s by people who are pure physiologists. So all these disciplines were coming together gradually. And obviously, we must give a nod in the early 20s and 30s to Freudian psychology. Freud, by the way, was a neurologist. And again, with direct gunshot injury to the heart cardiac surgery was just starting out, because initially there was no such thing as a heart-lung machine, but with experimental techniques and various pioneering surgeons, had devised on their own time cardiac pump, and that was the early days of cardiac surgery, because you cannot operate on a beating heart, and so that was required some alternative technology type thing. So, okay, and let's see if I can go to the next one. Yes, okay. By the way, just I was interested that last time, some of you and Dr. Joel had mentioned the African American history. So I just decided to look it up, that whether there was indeed a plaque for her on the Riverwalk in Tampa. And yes, indeed. That's in my sitting at home, I was able to find the slide for a plaque for the Clara Fry, who was a nurse who moved from Alabama to Florida and had started a hospital for African American patients in Tampa. And again, that she, the hospital survived in different various forms, and was managed by Tampa General. And she's been memorialized in a pavilion has been made at Tampa General Hospital in her front. The hospital actually closed due to lack of funds and overcrowding. And by this time, that was after Civil War, other arrangements available. So that's a piece of local history that I'm sure Dr. Joel will talk more about. Okay, speaking of race in America, one would think that it all ended with civil rights and everything was nice and not to be true. Back in the 1970s, an enterprising reporter had discovered something that came to be the shame of the research community, that something that was done, which was called Tuskegee study, that was carried out on unknowing African Americans, and even though treatment was available, they were denied the treatment. And this was a very shocking discovery, that they were followed for the natural history of tuberculosis, the Tuskegee trial, and finally, I think Bill Clinton apologized for the trial. And so this was the termination. The study was continued till 1972, and there is a very well-known book that's written about it, examining Tuskegee. So that was, and no wonder that the African American community has suspicion for research community. And again, some of you may have read the popular book, The Cells of Henrietta Lacks. That again, now that is a little bit, as far as I'm concerned, a bit on a shaky ground, because usually the tissue that is collected is discarded. But again, some of the agencies and institutions monetized on that from that thing. So, okay, and I think my slides are not advancing on the other thing. So I will stop the share again and perhaps start a new share. Okay, let's see if that advanced, and I will try a portion of the screen. Yes, and I will move that around and see if that makes a difference, because that might be, because I just realized that the slide on the other monitor is not advancing as well. So I apologize for that, and I will see if I can share this portion. Okay, now I think I'm hoping that people should be able to see this slide. Okay, that is the race in America that I was talking about, type of thing. And again, the problem you think has ended in 1972, but that's not the case. Okay, it continues, and even now the heart disease mortality has decreased for African Americans from 354 to 308, but at the same time, they're still lagging behind Caucasian or white population, where the mortality has decreased from 298 to 240. Similarly, for other diseases such as breast cancer, the 5-year survival rate lags behind. Only 80% of African Americans survive for 5 years, while 91% for Caucasians. And when it comes to pregnancy and child-related complications, the African American mortality is, I find it hard to believe, is as high as 240% higher than the white population. So the discrepancy still continues. I think so. Again, I think my slides are not moving like they should, for whatever reasons, type of thing. So again, let's stop this screen share, and let's see what's going on here as to why the slides are not. Okay, maybe. Oh, I'm sorry. I think I just had some blank slide. That's why you should be able to see this ones now. I will go back to slide share. Okay, portion of the screen, share. Okay, and okay, I think we should be able to see this slide now, hopefully. Okay, yeah, so this is where we are at, where now I did not, for the sake of brevity, I did not put the slide of the early advances in genetics, because in the 1920s, genetics was coming to end based on analysis of based on fruit fly mutations, which were assessed laboratory with a microscope and eyesight. Morgan and his associate at Columbia were able to plot genes at a particular site. And the concept of gene is old. It was in the early 19th, at the end of 19th century, was proposed, based on science, biological science type of thing. And but that led to the concept of if gene were thought to be responsible for everything, and Darwin's cousin Galton proposed the idea of that all the characteristics and physiological functions were hereditary, including intelligence. That led to the rise of eugenics, and this was primarily racist Victorian agenda with the rise of industrial revolution, and he encouraged the so-called well-educated, rich upper class to breed, and thought that that the lower class should be sterilized to improve the genetic pool. That was the birth of the so-called, which obviously we know that genetics is far more complicated. It was the rise of the eugenics movement that started out in Europe, but was embraced enthusiastically by the United States. And again, this times in very appropriately with the further migration from Middle Europe and the Latin countries and the Russian Jews. So again, the selective immigration policy played right into its hands, and the eugenics movement was supported by various who is who on both sides of the Atlantic. And then the forced sterilization was carried out for people who were just based on their appearance alone. They were considered to be imbecile and morons, and all those terms which we frown upon now came into existence. And a guy at the Cold Spring Harbor Laboratory, a psychologist named Dr. Goddard, was a big who is who. And the movement lasted from early 1900s to about 1930. And finally, it was put in its proper perspective as a pseudoscience. And this was again followed the pseudoscience of phrenology, which is diagnosing your intelligence and race based on appearance of bumps on the skull. So science has their false starts, as again. So and Dr. Mukherjee has written a very nice book about genetics, and so it's a big, interesting historical piece that may be of interest. Okay, and let's again see. I think we're having a glitch in the sharing business. Okay, I'm going to go back, stop the screen share. And start all over again. Okay. All right, and I will start my PowerPoint again and see how we can do this time. Okay. And let's see where we were. We're at about slide 60 or something like that. We'll go back to that and Okay, so hopefully it will work better this time. Because I think I had too many windows open. Okay, I think you should see this slide now. So we talked about the genetics type thing, but at the same time, there were people who were doing very good work, including one Greek immigrant named Dr. Papanikolaou, and he had migrated to US in 43, and on his own, with the examination of cervical smear, he was able to isolate the cancer-causing cells, and that was a start. It took him almost several decades to get this technology improved, and finally his technique was accepted, and that revolutionized the preventive aspect of cervical cancer dramatically. Uh, okay, so that's and then now obviously there are better ways to diagnose cervical cancer. The Pap smear was recommended every 3 years, and with more sophisticated immunological and PCR type of technique, now we are able to diagnose cervical cancer very easily. And now there is even a vaccine available called Gardasil for prevention of cervical cancer. Okay. At the same time, on the endocrine front, varieties of drugs were available, which was the invention of cortisone, okay, which was diagnosed at Mayo Clinic by Kendall and Associates, and that revolutionized treatment of varieties of illnesses. It was almost like the miracle drug for non-infectious diseases, and endocrine discoveries, came into foray, and cortisone became for so-called autoimmune diseases a big step in the treatment. And for Addison's disease, where people have inborn defect of cortisol hormones, and the famous patient was there for none other than our President John F. Kennedy. Okay. Obviously, the attempt. And on the tails of the discovery of penicillin, the treatment for the more chronic illnesses, which was really a massive cause of death and was romanticized as a romantic death of a pale, lingering death, which required treatment in sanatorium. The harsh reality was more different, was in the poor, overcrowded situation with poor nutrition and crowding, because not everybody was able to go to the so-called magic mountain. And this treatment was again discovered from a fungus, uh, uh, which was discovered in the soils around New Jersey, and was discovered by a Dr. Waxman. And the study was for the first time being funded by Merck Pharmaceuticals. His Dr. Waxman was not even present with some of the work, and the work was done by his graduate student, who was not given credit and was not given nod for sharing of the Nobel Prize. So that was the first time there was a controversy that had started. When the treatment of tuberculosis, and the discovery of streptomycin was revolutionized the treatment of chronic disease illnesses, because tuberculosis was been around with mankind for ages. So that was another big step forward in the treatment of chronic and infectious diseases. And then later on, it became available that the bacteria are smarter than the fungi, which is the arms race between various forms that continues. And and other drugs were developed, such as in triple drug therapy became the norm. And prior to that, the vaccine was available. So varieties of advances were taking place. But the bacteria have continued to win the race, and we thought that we would conquer this chronic disease, but that's not been as easy as thought. And now not only just multi-drug resistant tuberculosis came available, then extensive drug resistance tuberculosis is developed. The treatment of more drug resistant tuberculosis is very expensive and is not easily accessible to developing countries. The problem literally exploded after the breakup of Soviet Union in former Soviet Russia. and also obviously in sub-Saharan Africa, and again became much more uh, problematic after the HIV. So that, and you can just see the cost is staggering. There is no easy way that a developing country can afford these costs. Some of these drugs are still under a patent. Thank you very much. And that has become a big, and we talked about Dr. Paul Farmer's effort to make drugs available through the WHO for people who were incarcerated and especially in Haiti. So some of the pioneering work, he unfortunately died due to heart disease, or most likely, I think there was just recently a man who would have surely deserved a Nobel Prize. And this was, and although we are focused on COVID, the drug resistance, antibiotic resistance is a big potentially smoking gun, which is waiting in the wing, and the varieties of organisms are resistance. The very third level or fourth generation antibiotic called carbamazepine, that is a drug that is a bacteria that are resistant to it, and also then MRSA has become a big problem, and there is also a fungus, a simple fungus, a toenail fungus, Candida. One of the strains of Candida is resistant to antibiotics again, and that can become a real life zombie thing if it spreads. So varieties of organisms are still waiting in the wing to strike the human race, and obviously some of you may be aware of the C. difficile infection, which can occur after being chronically ill and receiving other antibiotics. So this is an organism that can cause severe massive diarrhea and is responsible for several deaths. So every year, almost 30 to 40,000 people die just only in the United States from antibiotic resistance, and the number of infections are in the millions. And the drug companies I may have alluded to before are not too interested in developing antibiotics because the treatment is short duration and there isn't that much money to be made. So the cupboard is sort of empty. And a lot of the treatment alternatives that we take into account is daily easily available will go by the wayside if we run into severe antibiotic resistance and if the problem continues to compound, such as all cancer patients require protection with antibiotic, organ transplantation, major surgeries, but anything is placed artificially inside the body, and the diabetics are vulnerable to even the simplest infection. So this is a major problem that is still, and the UK is doing a much better job with the United single payer NHS system, and they're able to reduce the inappropriate use. And so both sides are guilty, not just physicians, but the patient. And we'll allude to more when we talk about the interrelationship between two sides. And this is I cannot resist not showing this particular slide, okay, which is antibiotic resistance. This was an experiment that was done at Harvard. This is the link, and hopefully this will play without violating copyrights. Okay, this was an experiment that was done that they took instead of petri dish, they put the organisms E. coli on a long plate, and increased the antibiotic concentration from 10 to 100 to 1,000, and put the bacteria stained in white, and you'll be able to see how quickly mutations develop and how quickly they can overcome even 100 or 1,000-fold concentration of antibiotic.
So what we ended up building was basically a petri dish, except that it's 2 feet by 4 feet. And the way we set it up is that there are 9 bands, and at the base of each of these bands, we put a normal petri dish thick agar with different amounts of antibiotic. On the outside, there's no antibiotic. Just in from that, there's barely more than the E. coli can survive. Inside of that, there's 10 times as much, 100 times, and then finally the middle band has 1,000 times as much antibiotic. And then across the top of it, pour some thin agar that bacteria can move around in. The background is black because there's ink in it, and the bacteria appear as white. First, you see they spread in the area where there's no antibiotic, up until the point they can no longer survive. Then a mutant appears on the right, It's resistant to the antibiotic, it spreads until it starts to compete with other mutants around it. When these mutants hit the next boundary, they too have to pause and develop new mutations to make it into 10 times as much antibiotic. And then you see the different mutants repeat this at 100. And after about 11 days, they finally make it into 1,000 times as much antibiotic as the wild type can survive. And so we can see by this process of accumulating successive mutations that bacteria, which are normally sensitive to an antibiotic, can evolve resistance to extremely high concentrations in a short period of time.
Okay, so that was impressive, that as to how quickly it developed. So I think, but it makes sense because bacteria were here a lot longer than we have been. So not a surprising thing. Okay, and this is a cartoon of variety of site. The names don't matter much. The one that we recognize is C. difficile, and even good old-fashioned venereal disease, and Neisseria gonorrhea, is developing resistance. So we may be stuck with good old mercurial treatment, and it's too horrendous to contemplate. But so I think the antibiotic resistance is that real issue, much bigger, large than you can advise. And there is, tons of stuff written about fecal transplant. So one can donate the clean poop, basically. And that's sounds gross, but it really works. It's a dramatic improvement over this thing. So, but I think, I did a class of whole on antibiotic resistance, so I won't dwell too much into it. Okay, all right. And now, interestingly, wars are good for medicine type of thing. During the First World War led to the rise of plastic surgery. In the Second World War, with the side effect of mustard gas and stuff, some enterprise, these names are known well to the physicians because the Goodman and Gilman were they wrote a very famous textbook of pharmacology that's been used all over the world, basically. And they identified the response to nitrogen mustard in low doses to various advanced cancers. There are two types of cancer, carcinoma and sarcoma. Sarcoma spread very quickly, and the tumor regressed, and the effects were not permanent. So that one can say that was the start of chemotherapy procedure. And followed by that, the treatment was taken up, by Dr. Sidney Farber, who was a pathologist at Boston Children, and he decided to take the step further and discovered various what came to be known as anti-metabolites, and along with that, and after and established a cancer wing at Boston Children's Hospital. Fortunately, he had a big ally in Mary Sanger, who increased the funding, and there was the rise of March of Dimes for curing childhood cancer. And so that was, and so with the varieties of odd people who were, and initially, again, people thought that this was a fool's errand because these children were suffering infections, and then they were quite sick, and the response rate was very poor in the beginning. So, and further, and few pioneering oncologists, undertook this, not just in Boston, but I think in St. Jude's Hospital in South, and initially they tried with one drug and two drugs, multiply, sometimes as many as 7 drugs. And these children, as you can imagine, they became quite ill, and it was a challenge to take care of for not just for the physicians, but the entire staff. And eventually, but they persisted, to their credit, and they started seeing more and more successful result. So that was, and that tends to be said as to be one of the biggest miracles, with persistence and human ingenuity. And again, I will quote the famous science writer, physician science writer, Dr. Siddharth Mukherjee, who wrote The Cancer Emperor of Melodies, which was made into a TV series by Ken Burns. So that some of you may have seen it already, so I shan't elaborate too much on it. On the fact out, there was initially people were focusing on heart valve disease, and accidentally a catheter, which is a hollow tube, which fell inside the coronary arteries, injecting dyes that when Dr. Mason Sohn was doing tests at the famous Cleveland Clinic. And so, and that was the start of coronary angiography, and that led to the heart surgery. So that occurred in 58. So all the events were coming together in the early 50s, type of thing. And at the same time, from across the continent, our pioneering scientists devised a treatment for blood pressure, because initially the treatment for blood pressure was just very primitive with some diuretics and lifestyle modification. And with the advent of cigarette smoking and obesity, with the in the middle classes in the Western world, incidence of stroke was expanding, and the various drugs were available. The initial drug that was available was from India, from natural plant, and there was a start called Serpacil, which was marketed by Ciba Geigy, called Riserpine, and subsequently beta blockers, which blocked the adrenaline response, which was related to stress. When we are under stress, the body produces adrenaline. So Dr. Black in UK came up with the concept of beta blockers and receptors, and that was the start of appropriate therapy for blood pressure, and that made a dramatic improvement. At the same time, on other fronts, after the advance of heart-lung machine, Dr. Lillehei and Dr. Starr, pioneered cardiac valve surgery, and at the same time, a pacemaker was introduced, by assistance from metronome and the advent of transistors, which again occurred more or less at the same time from Silicon Valley and Texas. So all these discoveries where science was coming together with the advance and further, the incremental advances were taking place in treatment of human diseases, of varieties of illnesses. And from Oregon, Dr. Starr, along with the assistance of engineer, came up with a ball and cage prosthesis, which was replacement of heart valve surgery. That was so heart surgeon and engineers combined. And again, that was a different era when physicians believed in that they were working for a cause and were not looking to establish for patents. And Dr. Starr did not seek a patent on his ball cage Starr Edward valves. But Mr. Edwards was an engineer, so he obviously sought for a patent, and that was the start of Edwards' company, and they were the big giants in prosthetic valve surgery. Initial valves were noisy and crushed the red blood cell, but gradually advances took place in varieties of valve design with the input from surgeons and engineers. Now, again, drum roll, please. The biggest advance that took place was the earlier epidemiology from Bradford and Hill was done in UK, which showed a clear association between cigarette smoking and heart disease and cancer. But it took another 10 or 20 years for medical community to come around, as you can see, and there were commercials that were done. There's a lucky strike that cigarettes that doctors smoke. And you may recognize this man, who was a B-grade actor, was promoting cigarettes and lived to be went on to be president of the United States. And the Surgeon General finally in '64, in spite of all the lobbying, the federal government intervened and put the warning on cigarettes, and that has been the biggest advance, not just in heart, but in cancer and increasing human lifespan. Okay, so if I had to pick one, that has to be the one. Okay, and at the same time, there are varieties of studies that were done which promoted risk factors such as smoking, fat, obesity, hormones, oral contraceptive, and exercise. The nurses' heart study that was done over the span of almost 50 years, I should say. So they've contributed dramatically, and there have been as many as 1,200 publications. So epidemiology moved right along with advances in preventive medicine. So we must give enough nod to that. Okay. And at the same time, all of you may remember the Nixon's war on cancer, and that, eventually it was not that easy to this thing, in spite of spending a lot of money. the cancer research was still there were progress done in so-called hematological or blood-borne cancers, as we saw earlier, but the solid tumors were still a hard nut to crack. And finally, there is a fascinating story that I must share, even though it is a little bit sidetrack type of thing. And still, cancer is still it's not just one disease, but it's multiple disease. So still varieties of problems with the advent of molecular medicine and cellular medicine and genomic analysis sphere. Finally, maybe we're getting to the really mind of cancer, so to speak, and it ties in with the evolution, so to speak. And still varieties of problems, as you learned, for those of you who are more science-minded, may pay attention that the DNA level, we are able to do various mapping, role of gut microbiome is coming into existence, and even though and cancer is not localized to one particular tissue, but it may have a different characteristics when it metastasizes. So varieties of problems still remain. And again, Biden is declaring the so-called moonshot of cancer, and hopefully with the more fundamental understanding of sciences, we may have some better luck this time than we did earlier. Okay, let's see, what do we have here? So, okay, I don't know why I've created blank slides in between, but okay, now this is a fascinating story as to, based on the diagnosis of chromosomal analysis of pioneering hematologist named Brian Tucker, intentionally went on to devise a drug that would block the enzyme deficiency for tyrosine kinase, and was able to come up with the drug for myeloid leukemia. And there was the name is not that important, but it's called Gleevec, and that had almost a 90% success rate, and was the first time was able to treat acute myeloid leukemia in childhood. So, and that was the big out of the ballpark hit by the newly formed genetic company called Genentech. And that's another story as to how molecular biology developed on the West Coast, along with the collaboration of technology and other stuff. So, and again, Europe and UK were far behind in taking advantage, even though they had done a lot of the pioneering work in, okay. All right. And again, it's like along with this, along with diagnosis, we, sometimes tend to overdiagnose a lot of the illnesses, and even just simple things as to that the biggest problem that comes up in science is statistic or so-called Bayes theorem comes in the way, type of thing, and it creates a big problem from time to time in terms of okay, I'm just going to refocus the slide so I can have my notes available to me. Okay, all right, and let's see. Yeah, I think hopefully you should be able to see it, type of thing. So, okay, so now I know we tend to overdiagnose things sometimes because of the probability, and again, so this is where sometimes the cancer progresses at a different rate, type of thing, as to when certain time when some cancers that are very slow growing, such as prostate, can cause, which is, yeah, and so this is, can become a problem. Okay, so, and prostate is a easy one, because sometimes, we'd say every older person is likely to have cancer for prostate, after 75 to 80. But, again, this doesn't always become fatal. So this is, overdiagnosis becomes a problem, type of thing. But sometimes, physicians have the tendency of overacting, type thing, because they don't have a fear of missing the diagnosis, type of thing, and say, oh, it may be harder to treat later on, type of thing. So the variety of technology are being overutilized, type of thing. And the same way, we are diagnosing and overtreating a lot of things. For example, the big thing about the testosterone level, type of thing. And similarly, other illnesses are also being overdiagnosed, such as attention deficit disorder, and varieties of guidelines for so-called pre-diabetic levels. So that's still become a big problem type of thing for physicians, and in general, especially in the developing countries type of thing. So, okay. And sometimes, we, pharmaceutical industries, tends to promote a lot of the illness is as well, and so, and okay, when we continue our talks with cancer, that all the cancer progress and survival statistics, can be, somewhat of a misleading, because some of the cancers, the percentage of screening population is fairly large, and where it makes a difference is such illnesses such as colon cancer. In breast cancer, again, sometimes you can get false positive mammograms. So that has to be interpreted cautiously, type of thing. And for lung cancer, is still very difficult to diagnose, because even annual chest X-rays have not panned out, and a low dose CAT scans have become available, and even the bigger agencies have not come to terms as to how often mammography should be done. There's a difference between gynecologists and other subspecialties. So that again, as to how often we should screen people, that still different countries and different areas have different guidelines that are established. So just because there are guidelines doesn't mean they have been solved the problem. And again, there is an example that is worth sharing, that in Korean surgeons were when they started doing ultrasound screening, that tended to overdiagnose thyroid cancer, and it was almost like becoming an epidemic of thyroid cancer in Korea. And so they were diagnosing and taking out thyroid glands. So you can just see over a period of few years, unnecessary surgeries had increased, type of thing. But again, and that surgery is not just only expensive, but it also had risk of causing damage by removing an associated gland called parathyroid that is close to the thyroid gland. So, and there was almost a 15-fold increase in Korea. But finally, the societies of experts, ENT surgeons, came to terms, and things have come into. And so, and again, at the same time, when you overdiagnose, investigate, and the same thing, the problems occur with melanoma. Okay, and there are and people who are doing the analysis for healthcare policy have seen when there is more access to complicated equipment. For example, if there are more CTs in South Florida, and so that's why there are more nephrectomy that are done, that is removal of kidneys. So that's again, overdiagnosis has been a perennial problem, at least especially in the United States. And so just to quote, another thing, to a man with hammer, everything looks like a nail. So more CAT scans for fewer kidneys. So you can see the diagnosing. Similarly, in melanoma, how we are diagnosing new cases with more screening, but at the same time the number of deaths have mainly remained same. Okay, and the same thing for prostate cancer. We think that there is an epidemic of prostate cancer, but we're not making a whole lot of difference in terms of death, so to speak. So not all cancers progress. It can be misleading type of thing. So okay, and every time, and the drug companies have their own share. Like even when you drive past on 275, used to say live longer with Keytruda, but when you look at some of the 80% of the drugs, they really don't seem to make that dramatic a difference. And some of the drugs, when we look at the real life situation, they may prolong your life by as little as 2 or 3 months, type of thing. Okay, and all right, and just to rehash the statistics with, like more better with more PSA levels leads to more ultrasound, to more biopsies, and 80% of the male over 80 will have some type of prostate cancer, but only 2% will die of it. And just to summarize, the varieties of treatment choices are available, starting from surgery, of course, to laser and cryo, and we have all sorts of robotic surgery and laparoscopic surgery. And again, just to emphasize, just because we've got newer technology does not mean they're necessarily better. And we've increased the cost dramatically. For example, with proton therapy, they're like a multi-million dollar equipment type of thing. And in terms of real success, the biggest success story was Gleevec that I already shared about. Now again, we are making some progress that the cancer rates have decreased with the advent of immunological therapy and monoclonal antibodies. We're finally beginning to see some light at the end of the tunnel type of thing. So, okay, so maybe this time we might be more successful, as I alluded to earlier. But at the same time, this research is very slow and it takes time. It would be interesting to share a story of a drug called Avastin, okay, which was one of the earlier mouse monoclonal antibody that was devised. It stopped all the tumors have excessive blood vessels, called angiogenesis. This was proved with cell biologist physician who worked at NIH named Judas Folkman. Okay, and his idea was again very questioned, and then he advised a drug which would block, this blood vessel growth, and so there was a rise of monoclonal antibody therapy, and this was the drug that was devised called Avastin, and again, while the studies were being done on a trial basis, the breast cancer community, well, the patient-related agitation appealed and attacked almost the Genentech company, saying people are dying, and got the approval was given. Subsequently, was turned out that did not the data did not bear out, and the approval was withdrawn. Okay, so just sometimes science is very slow in terms of correct scientific methodology need to be pursued. And similarly, in the drug company, the drug has also been said to be some benefit for macular degeneration, and the company that markets it, refused to manufacture in a smaller amount that was needed for eye testing, and the cost of Avastin, and the company, by the way, the drug is made by a Swiss multinational pharmaceutical giant called Roche Pharmaceutical, and the cost of the drug when the eye surgeons were mixing it themselves and assembling this required dose, that would be cost about $40, but they came out with a newer formation which was pre-packaged with the standard doses and renamed it and remarketed it, jacking up the cost to $2,000. So again, the same drug, smaller amount, well packaged, the cost was dramatically different, about 20 times more. And again, so this is, some of the public health and statistical methods have made a big impact in terms of treating. And this is something called the Framingham study that we should be acknowledging. It was started back in the 1948 and is still continued. And thousands of papers have been generated from Framingham study, advancing the treatment of preventive medicine, such as heart disease and strokes, which were the major cause of mortality and morbidity in the United States. Okay, and moving on to, and that again, sometimes the science can go from the wrong turn, because in the early 60s, based on just this observational data, we thought that the low fat was the culprit before we understood the metabolism of insulin and sugar production and the varieties of hormones that control the appetite. And so that low-fat diet was recommended. And unfortunately, we did not understand the human physiology that well. And people just started substituting simple carbohydrates and reading right through the phenomena of insulin resistance and increased obesity. Okay, so this was, and the low-fat diet became very popular. While it was useful for high-risk cardiac patients, but was not dramatic for the whole nation as a general. And so low-fat became an overreaching ideology, was promoted by the federal government, physicians, and food industry, and health media type of thing. So, and people bought the idea when it came from authority type thing. There was no clear-cut evidence that it made dramatic difference for a relatively healthy patient. So the low-fat approach became an ideological warfare, and people started getting more and more overweight by increasing calorie intake of simple carbohydrate and insulin. Okay, and that led to the obesity epidemic that we're still fighting. And then we talked a little bit when I talked about diabetes about the popularity of the new weight loss drugs. And sometimes, again, how science backfires, that there is something called good cholesterol in the body, and a drug that was devised for treating the so-called HDL or good cholesterol, and a well-known pharmaceutical giant, Pfizer, bought the drug for $800 investment. But again, when the drug was put to critical trial, it did not pan out. The adverse effect, it did raise the numbers in the blood test and increase the efflux, increase of the cholesterol, through various pathways, decrease the numbers, but did not make dramatic difference in mortality and adverse events were outlet this thing. So sometimes what that becomes very obvious, does not pan out in your life, because human body is a lot more complicated than we give credit for. And again, looking at the varieties of technology that became available, and the physicians was relying on his senses, that is, inspecting, palpating, percussing, and auscultating, the basic criteria that was devised, was replaced with simple X-rays with contrast called barium X-rays, followed by CAT scanning and MRI scanning. Okay, so these are varieties of technologies called molecular imaging revolution that has taken place. We can peer the inside, and that has caused to decrease in, okay, and then again, from my own example, I was an ultrasound person, that our echo technician, actually, to give credit, he saved the patient's life. Just to trip down the memory lane, a young woman who had just had a labor and delivery and had delivered a baby, and as a gynecologist who was a good clinician enough to listen to a heart murmur and set her down for ultrasound. And to lo and behold, her aorta, which is the big tube that goes from the heart that takes blood into the body, wrapping around underneath your collarbone, and that had torn almost like a piece of onion. The blood had seeped between the two layers and was dissecting, which is a life-threatening illness. So within 4 hours, she underwent surgery, and I may have told this story before, but it's worth telling, type of thing. And obviously she did well, and we followed her for blood thinners for almost 20 years. She was working, and I had told that, well, you can come down after your work, and I would stick around in the office while working in the hospitals, and then when she would come for a blood test. And then after I had retired, I was picking up books at the local library, and one young man said, "Are you Dr. Soon's pathology?" I said, "Yes." "Let me shake your hand." So you took care of my mom for 20 plus years, So this was a very rewarding experience, I can say that, And at the same time, technology that I was involved in looking after a football player who came in from the so-called USFL to NFL, and he was getting winded just running up and down the practice field. So he was sent for a physical type of thing, and I was sent to, and we must have our thinking caps on. So we, instead of just doing a regular heart scan with injecting radioactive material and doing a stress test, we did something called a combined cardiopulmonary stress test. So 2 physicians were present, myself and a lung specialist, and we not only measured his heart capacity and his heart function, we also checked the amount of oxygen he was breathing, and turned out that he was not, malingering, or he was not just out of shape physically, but he was actually, his oxygen level was going down. And this was occurring in a healthy 28 football player, because he was getting blood clots from his legs, and that was causing him to get short of breath. And so this was one of the examples where collaboration and right amount of thinking. And so he was placed on blood thinners, and obviously that lost his career, but perhaps saved his life, And at the same time, when we've seen abuse of technologies, when a lot of the nurse practitioners who have a little less experience based on just the fear of missing anything, they would order a $3,000 nuclear scan and on healthy, skinny women who have no risk factors. And even the test was abnormal, we would have at least a 5% false positive chance due to shadows from the breast. So this was, an overuse of technologies type of thing. That is becoming. And again, I was hoping not to show too many videos, but this is dramatic. I should share that with you.
Well, why do we want this scanner? Well, this is what the machine can do. This is not a simulation. This is a real patient. We scanned this patient, their entire heart, their entire aorta, the chest, the abdomen, and the pelvis in 9 seconds, and produced this level of detail of the fine arterial anatomy throughout the entire body. I call these eye-popping, eye-candy images, and they're truly impressive. The diagnostic power is amazing. If we concentrate just on the chest, here's the aorta and also the coronary arteries you can see as they rotate. This patient we were particularly interested in because they had an anomalous vessel down here, which went into the lung. But you can see the extent of coverage and the detail that's produced, and in this particular case, in 6 seconds. Dr. Goldberg talked about carotid disease in the neck. We know that you get plaque in the neck, and that leads.
Okay, so you get the idea type of thing. So this is dramatic. And in the early days, when the early 50s, when CAT scan was diagnosed, just to scan brain, which does not jump around like heart, it took almost an hour to scan the brain. And the images were of far poor quality. Now, granted, the technology is improved, but at the same time, there is abuse potential that sometimes, unscrupulous groups of specialists, set up a screening tents in churches, and screen for blockage in the arteries, and then fudging the data, saying, oh, well, you have leg pain, so that must be the blockage, which is not symptomatic and not cause any problem, would require angioplasty or balloon job, and create business, and scamming Medicare, and taking, for example, of gullible patients. And again, this has been set up more in low-income areas, especially in African-American communities. And people who have done research have shown that, yes, this is really a perennial problem. And I've seen some heart surgeons, again, do that for also just to screen people and to generate income on the side, because that's a relatively easy work for them. And so, again, these scans are not innocuous because there is an amount of radiation. With ultrasound, there is no radiation, but with regular X-rays, this is like 230 days of natural radiation, a CAT scan, and you can see as much as 460 hours of flying, enough amount of radiation that can come down. And samely, again, we talked earlier about breast cancer screening because of false positive test, if you can overdiagnose breast cancer as well. Okay. So there is, that's again a perennial problem that one needs to be cautious about. Okay, and moving on to further things, type of thing, there are pollen and grass, leads to asthma and climate change with growing season, and so a lot of these things, the triggers for asthma are wide and varieties of type of thing. Okay, which include infection, allergy, varieties of drug code. So and a lot of new treatment are available other than the simple inhaler therapy. That's varieties of enzyme blocking treatment are now available for asthma. And asthma seems to have exploded all over the world. That may be related to air pollution, as you can see in this particular site, that in Puerto Rico, it's substantially higher prevalence. And compared to Caucasian population, again, low-income groups have higher mortality and morbidity type of thing. So this is, and again, so this is, so the numbers change dramatically, and they do not, some of them do not respond to common drugs. And the things that this may be related to, we may be to the microbial flora, and we may the microbial flora that gives us immunity development, we may be becoming too clean. So this is a missing microbe, how microbes have involvement in health, and we did some classes on microbial-related heart disease. So some of the autoimmune diseases, have propped up by, we may be killing the so-called good germs in our body, which give us protection, type thing in childhood, not having enough pets or living in a very urban climate, having more pollution, they all seem to have impact. Infectious diseases have gone down, as you can see, rheumatic fever almost disappeared. Measles have decreased with vaccination, so has tuberculosis in advanced countries. But the so-called autoimmune diseases, where body's own cells attack the body, have increased dramatically, type of thing. So, okay, so, and that people have made promise that let them eat dirt, that having a sibling or having a pet reduces. And the study was done between the two Amish populations, people who work on the farm, they get their hands dirty, so to speak, have far less incidence of asthma and other autoimmune diseases. Okay, and so there are varieties of reasons why doctors overorder tests. Sometimes they claim that that's malpractice or just to be safe and want more information. And the way we are trained is to not to miss anything, because the biggest crime for medical residents and mass general is to miss a diagnosis. And sometimes the patients are at fault also. They're insisting on more test type of thing. And doctors do not want to take confrontational this thing, especially. And so then I feel patients should make final decision. And then it's a lot easier to order the test rather than to discuss it. And again, so this is so new technology. So we are again becoming like kids in the candy store. We'd love to get new tests. And I was always surprised that from the smaller villages, smaller town hospitals, I used to see doctors jump onto a new bandwagon of new drugs very quickly because the salesman just at the office, the detailman, so to speak. And again, with the imaging, the unnecessary test is doctors realize it fully, but they still indulge it in anyway, type of thing. Okay. And but if people ask for an unnecessary test, and even if they know that, they would still order it if the patient insists, type of thing. So again, so that's a big problem, especially with the fee-for-service system. Okay, and at the same time, with other major diseases, kidney failure, pioneering doctor who's created a dialysis machine on his own using really homemade tools, in the aftermath of war type of thing, sausage casing. I mean, it just sounds dramatic, but he said, and then he moved to the United States, and again, as the practice was in those days, he did not seek a patent, and the dialysis became widely available. And I'm sure Joel will talk more about it, about the local experience, and that's revolutionized the treatment of chronic kidney disease. Okay, and again, that has again become commercialized and monetized to the nth degree. That and then that and to get dialysis, simply you need to connect the dialysis machine to the arterial channel and the venous channel. So you need to create a communication called vascular access type of thing. And the new two ways to do it is to connect the artery and vein directly, so-called fistula, and as to put on a graft type of thing. So okay, so that the two technologies that are available type of thing, and the surgeons have and the nephrologists have learned to monetize, and they're learning the technique, and the business of dialysis has become heavily commercialized and has been led to a giant for-profit corporation, which a company called DaVita operates at 37% of the market type of thing. And so that it's become a dramatic business. And again, a lot of the dialysis is not, people have a low blood count, and varieties of expensive medicines which stimulate the bone marrow to form red blood cells are being available. And again, the threshold for treating patients has become lower and lower. But there are some agencies which are doing, because in the United States, a lot of people do not want to make any effort in having treatment called peritoneal dialysis, which requires some effort on the part of the patient, but it's far more cheaper, can be done at home. But there is a company from out of Tennessee, which is a private concern, and that is making serious attempt at offering, called Monogram Healthcare, and their home dialysis percentage is about 30% versus 10 nationwide. And again, they do not end up with emergency surgery. They have an established network of supporting nurses and staff. So there are people who are private initiative who are making an attempt at preventing the abuse and overuse. Okay, and okay, and sometimes, again, the families do not know when to quit, and can talk patients who have poor quality of life into signing up for dialysis type of thing. And again, the DaVita has settled a case for overuse of kidney care drug Epogen, okay, type of thing. So this is, and again, our track record for dialysis is not very good. You can see the fatality rate is worst in the industrialized world. And so overuse, underuse, and misuse of, and even people with dialysis, I have friends who are nephrologists who would say, well, people who are blind, diabetic, have poor quality of life, but the families would insist on starting dialysis. As I said, technology is relatively easy, and are we really doing the right thing? That the jury is out on it yet on all cases. And I talked about earlier about Art Buckward case, who was one of the few public figure who turned down dialysis. Now, again, this is, if you have to say, one of the major discoveries of the 20th century. This has to be the thing about the DNA, a molecule analysis of the structure of DNA by Watson and Crick at the famous pub in London, in Cambridge rather. Okay, and that was the start of molecular medicine, and science became even much more fundamental, and the whole biology was at the golden era from the 50s to 2000, when the Human Genome Project was completed. Okay, and so that was the start of the genetic, and this is the so-called timeline. And if I can focus on it further, I think my magnifying lens has disappeared, so I don't think. But you can just see, started from Gregory Mendel onwards to to the DNA double helix analysis, to molecular medicine, to the Human Genome Project, varieties of enzymes, and the PCR technology came into existence. So so the science has gotten a lot more fundamental than it used to be. That we are actually probing the inner working of the cell and communications of all the three basic molecules, such as the energy which comes from mitochondria, and the metabolism of protein, fat, and sugars, and the genes that control it. And we are able to compare the evolutionary basis. So all the things that would have occurred from the origin of first cellular life, and we are able to take advantage of it and devise specific drugs, targeted therapy based on, for treating varieties of abnormalities. But again, the number of protein permutations and combinations are huge. So the challenge is still dramatic to find an ideal cure, because a lot of the diseases are so-called polygenic diseases, and to devise a specific, it's almost proverbial looking for needle in the haystack type of treatment that we are dealing with. So again, that is, and again, for diagnostic process has been revolutionized also with the multi-omic analysis, that is doing the genomic analysis, not just your DNA, but your RNA and various proteins and various gut microbiome. So that's called the and the so-called epigenome. So that was, it's called the multi-omics technology, that is measuring thousands of proteins at the same time from a single drop of blood. And this technology is, and this was the recent report from Stanford, that they are, this is really, but at the same time, sometimes there is hype that the company that you may have heard about called Elizabeth Holmes and her boyfriend, they raised millions of dollars and for a sham procedure that they were faking data and taking advantage of investors. And finally, the company folded, and so there was a big trial that they're both facing jail sentences. Again, you can see the rise of Theranos, this thing that they started from 2003. She was a student at Stanford and dropped out and started this company and was able to hoodwink venture capitalists okay, all over the country. And the company raised billions of dollars and eventually folded, that they were just crooks type thing. So again, science has its share of rogues. But this time with Stanford study that may come out to be fruition, that in next few years, that may be interesting to see how it progresses. Again, in science, it has a step forward and backward, and I may have shown this slide that with genetic therapy, death had occurred, due to immune response in a young man who was receiving gene modifying therapy at University of Pennsylvania, and died as a result of this thing, and that set back the gene therapy dramatically. At the same time, there was self-policing in genomic science, and that you were not alter the germline modification, and the scientist in China had tried to modify 2 embryos and implanted them with artificial insemination in mothers, and to prevent them from getting AIDS in future, with the claim that there is stigma to HIV in Chinese society. And he was criticized. I was initially facilitated and considered as a hero for Chinese science, but then when the word opinion turned against her, he was sent. He was demoted and was sent to prison by the Chinese government because they were worried about the international reaction. So there are some rare mutations that take place that protect people from HIV. Okay. So gene therapy may cure some of this disease, but can we afford them? So that, because some of these treatments are millions of dollars type of thing, and again, so that the jury is out on it yet. On the other front, this story you may be familiar with, but it's worth repeating: the Sabin and Sac. Back in the 50s, polio was a big scourge in Western world as well as all over the world, and Sabin and Sac. There are different types of vaccine. One was a cured vaccine, another was attenuated through multiple passages in chicken eggs, and the Sabin and Sac were 2 pioneer scientists, and then so then the polio vaccine was marketed, and again, then they did not take out patent for the vaccine, and the most elaborate program of vaccination involving the field set up the test Salk vaccine was carried out with, the test was carried out with 20,000 physicians, school personnel, volunteers, and almost 1 million school children were participated. And the results were made available in April of '88. Jonas Salk was considered as a miracle worker and become the Sabin vaccine is an oral vaccine, a weakened strain of polio vaccine, and was easier to administer, type of thing. And so Sabin's attenuated vaccine was tested in Chillicothe, Ohio in 1954. And so that is the norm of the day. And now nearly almost all countries have eliminated, except for a few isolated pockets in 4 countries: Pakistan, Afghanistan, Nigeria, and Laos remain. So the polio has been, the success of mankind. But at the same time, we know that has a back of it against vaccination, which we saw very much in play during COVID vaccination. And at the same time, along with COVID, the vaccination rate for other required vaccination for school attendance dropped dramatically, leading rise to a surge in well-conquered diseases such as measles and rubella. And so this is, the trial of COVID, which was Moderna picked up $1 billion in research aid. And again, that was public funding was provided, but to your chagrin and my chagrin, government did not insist on intellectual property that would have made the price, substantially less. But again, though Moderna and Pfizer have made out a lot, and it's still not been marketed for the no break for the smaller countries. Okay, and even though with their promises, they're not willing to share the technology, and they've only sold to the rich countries. So far, at least, So the production cost is about $3 for Pfizer, and the profits were, 20%, and the Pfizer CEO's word was, oh, it's very marginal, so to speak. They're going to earn about $100 million, $100 billion over 5 years, type of thing. Okay, but that was, again, you can say this was a modern success type of thing. Okay, and so the big pharma is our biggest thing that we are going to beat up on as we go along, type of thing. And then this statistics staggering, and people may take as many as 50,000 pills in the average life, 30 billion over-the-counter prescriptions per year, and how many it costs per year is just mind-boggling. And 64,000 people die due to overdose. And again, the drug and Hollywood was right on spot when they made an entertaining movie about the salesman who sells Viagra, as to how he became very popular for amongst physicians, and So physicians have actually sold their soul to the drug companies. Again, with the newer rules, Physician Payment Sunset Act that has become checked somewhat to some extent. I can tell you my own example. Back in the 80s, a new blood pressure drug was marketed. And they were holding a promo conference, which was actually just a sales junket. So the salesman had said, well, doctor, they would give me a ticket to fly from Green Bay to Vancouver. And to me and my wife, I said, I'm not married. Oh, you can bring your girlfriend along. So, but I think just I must have a clear conscience, I turned it down. And when we used to go to the American College of Cardiology convention, the pharmaceutical companies used to put on a big bash. They had they had arranged for a private Mardi Gras demonstration inside the dome, so to speak, thing. And again, there were so-called speakers bureau where people were just gently promoting their drugs type of thing. So this is, and even the who is who, some of the big names in cardiology used to come down to lowly Green Bay to give talks for the drug companies, with at some local restaurant generally. Again, so, and this was, and right on the tail of heart surgery and the kidney transplant where it became available, and after several years of dark years of rejection, and until the good drugs became available for a suppressed immune reaction of the body, their data was pretty dismal, and the people on the West Coast, continued with this thing, and finally, and at the same time, there was rise of the bone marrow transplant that took place on the West Coast at University of Washington. And this was, again, as a sequence of bone marrow suppression that occurred as a result of atomic blast, I think. So there was, the start of the more organ replacement therapy. And then the therapy became revolutionized with the availability of rejection therapy that came from the Easter Island called rapamycin. But at the same time, drug industry has their problems, that the United States was able to avoid the disaster that occurred in South America and Brazil with the side effect for a drug for morning sickness called thalidomide, which the children were born with deformity. Okay, so I think a couple of more slides and then we'll wrap it up type of thing. So we will and continue next week. Okay, so this was a disaster, and due to the physician whose name it escapes me type of thing, that she was, Frances Oldham Kelsey. She stood her guts and did not approve. There wasn't enough data in human studies, so the drug was never approved by the FDA in US. The US was able to avoid this disaster. And interestingly, in medicine, things come around that the drug is making a comeback for treatment of some chemotherapy as well as for leprosy. And from down under, somewhat of a prima donna surgeon named Christian Barnard, was the first one to do a heart transplant. And he obtained his training with observation and working under the more established researcher, Dr. Shumway, at Stanford, and he went ahead and unfortunately, to the chagrin of the transplant community, in his work, he never acknowledged the role that the other people who were ahead of him had played. And then again, so obviously, and his results were far less than ideal because it was before the anti-rejection therapy was completed. And on the other hand, a more persistent surgeon, Dr. Thomas Starzl, moved from California to Pittsburgh and continued to work on various organ transplants, including heart and lung transplant and liver transplant at Pittsburgh. And Pittsburgh is the mecca for heart transplant under Dr. Thomas Starzl, who just died, I think, a few years ago. Yeah. So there was, and at the same time, one of the surgeons that had come would work with Dr. Christian Barnard had moved to Tampa, and I'm sure Joel will talk about it. And he pioneered transplant surgery for kidneys and liver transplant in Tampa. His name was Dr. John Ackerman, I think. Okay, all right. And on the other hand, as to how the drug companies, have their own this thing, that there was a drug that was, some of you may recall, was marketed as a substitute for ibuprofen and Tylenol and aspirin for arthritis called COX-1 inhibitor. The name is not that important, but it was marketed by Merck that they for treatment of arthritis and degenerative joint disease. Okay, the molecule was discovered in '94 and was marketed, in '99. It was approved for osteoarthritis, and again, there was promoted it very vigorously type of thing, and again, promoted it for prevention of colon polyps. Okay, and again, meta-analysis after the market study found that there was a high rate of heart attacks in people who were taking this drug. And again, the label was placed on this thing, and they continue to promote that there are gastrointestinal benefits type of thing. And then the cardiologist at Cleveland Clinic raised a red flag about this drug type of thing. And finally, after several years of being aware that the company data was available, they continued to promote the drug vigorously. And finally, the drug was withdrawn after being in the market for several years. The New England Journal had expressed earlier letters were returned by Seattle Farm MD that were published in the New England Journal. And I'm sorry, was sent to the New England Journal, but again, the journal, due to concerns about the ongoing trial, did not publish the data from a lowly pharmacist on the West Coast. And so similarly, so the drug companies and so all of the East Coast establishment, publishing houses, and even the FDA failed to some extent type of thing. And similarly, they promoted another drug called Bextra also at the same time. And quietly, they paid a fine of $1.1 billion for promoting off-label use and continued to promote drug in spite of data that it was not safe. Okay. Again, so this is, okay, I think we should probably stop here because we have gone through the data about 60 slides and then can continue next week type of thing. So, because we'll talk about the transplant and the other ups and downs of pharmaceutical industry, physicians, etc. So I think I'll stop at this stage and I'll send this out and upload it to YouTube also. Okay, so this way Dr. Joel will have more time to discuss his memory trip. Okay, thank you, folks. I will end the meeting and I'll send out this recording.